Hi, my name is Bernadette Sherry, and I will be presenting Responsibility 7, which is communicating and advocating for health and health education. Responsibility 7 focuses, at first glance, may seem a bit overwhelming with its 6 competencies and 40 subcompetencies. However, there are many points addressed here which review information from skills already addressed in previous responsibilities. The difference is that they are applied into the realm of policy. So Responsibility 7 just describes roles and duties of what a health education specialist should be able to exhibit daily in reference to advocacy and policy across a broad spectrum of settings. These are some of the key terms that I will mention and touch upon while I'm presenting some of the information. These are great key terms to know, and I would suggest for you to further your knowledge on what they are and how to apply them. Okay, for how I'm going to present the competencies and subcompetencies, you're going to get what they are here. However, I'm just going to give you a couple of key tips or the most important aspects that you should remember for these sections. And in some cases, I'll probably just summarize what is meant by them. For 7.1, assess and prioritize health information and advocacy. You have, as a health education specialist, you have to identify current and emerging issues that may influence health and health education. And what does that mean? Exactly that. You must be able to identify what the issues are. Once they are identified, then they must apply evidence-based data and in a timely manner. This is a crucial part of remitting information to those who are vital in making decisions in order to create change. We all know that what is true today may not be true tomorrow. So research, evidence-based, and in a timely manner are really crucial to identify what the current and emerging issues are. For access to accurate resources related to identified issues, the data obtained must be credible and it must align with the partners and policymakers that you are advocating for in order to influence policy. Now, how to acquire the data and assure its credibility has already been covered in Responsibility 4. So this is one of the areas where you have already studied this, and this is a moment to implement it when it comes down to advocacy. 7.13, you analyze the impact of existing and proposed policies on health. A health educator needs to research the factors that contribute to the policies that are already in place and the factors for the policies that are being proposed. In other words, do some homework on what has been and what could be. Study the actual policies that are in place and apply the acquired results from the community needs assessments and scientific assessments. You must know the impacts of the current programs that support the policy, and always ask yourself if there are available resources to sustain the policy that is in place or the policy that you're trying to implement. And with analyzing factors that influence decision makers. This area, there are various ways to influence a decision maker. I'm going over the legislative advocacy, which is one of the ways. This is when a CHES individual speaks with policymakers to address a public health problem. They present well-documented data and empirical evidence to assist decision makers in creating laws and regulations. Another way to influence policy is by using media advocacy. This is another powerful tool that assists in changing the public's perception of public health issues and the importance of addressing them. Media advocacy assists in altering the norm behavior of the media to create change with public policy and practice. Now, just to note, although television and radio do reach a broad audience, they don't offer enough detail to the target audience. So it's not like your all-in-one solution. It's just one of the tools that can assist further other tools. And I guess using the radio and television along with the Web 2.0, or as we know, the internet, this is where it has two different advantages. It is utilized to spread information and messages about issues quickly, and the information can always be updated and tailored continuously. A CHES individual can also advocate by participating and assisting individuals or communities that have already started efforts in reaching health-related goals. This form of influence and advocacy would be referenced as grassroots activities. 7.2. All right, so for competency 2, we cover a variety of communication strategies, methods, and techniques. In order to design them, a health education specialist is required to incorporate behavioral theories in order to choose which channels the messages will be disseminated. Those theories were already covered. Well, some of them were already covered in Responsibility 3, so we don't have to go over the theories. Right now, we'll go straight to just creating the messaging. So 7.21 is create messages using communication theories and models. Here, consumers are consistently seeking information about disease treatment, disease prevention, and health promotion. Their perceptions about health-related messages are influenced by the ease of solution and immediate results, perceived susceptibility, and personal beliefs. With this information, a CHES individual should learn as much as possible about the target audience and what influences behavior change, and then meet those needs. When creating your message, the social marketing approach can assist in determining the consumer's needs and wants. The approach consists of a marketing mix that includes 4 components, and they are product, price, place, and promotion. Know what they are and how to gain that information. The message must also include the importance of community involvement with the health decision-making process. So what that means is once you get your information about what the product is, the price, the place, and promotion, this is all about behavior. So these 4 components need to be applied for behavior. The product will be referencing what the change is in your behavior. The price is, okay, is it gonna be hard for me to change this or not? Because that is a cost for them in reference to behavior. The place, okay, where do I have to go to get this done? Is it going to be, is it gonna be easily accessed? And then promotion would be, what do I get at the end of it? Is it going to be good? Is it going to be bad? Would they kind of pass on the information? And you would like to kind of support them and go along with it. And this is a great way to implement your messaging because you are involving the community. The community feels that it is theirs. When you study what it is that they need and supply them the information, they can actually pass on the information and it belongs to them at that point. Now, when you tailor messages to priority populations, the important things to know here are that health education specialists must be able to deliver messages across various cultures and reading levels. To begin, work towards cultural competency and be aware of the values and influences of the various cultures. That is one of the most important and crucial things a CHES person should know. Because if you cannot get through to your population, if you cannot get through to your target audience, you will not create the change, and you will not be able to gain the support that you would need to carry out whatever it is that you are trying to set forth. The culture influences the perception of health messages. So those individuals that encounter language barriers, or those individuals with low reading levels, are more susceptible to lower health because of the inability to understand, read, and access the health information. To reach these sectors of the audience, a health educator should use readability formulas. Some of these formulas are the Frye Readability Formula, Flesch-Kincaid, Fog-Gunning Index, and SMOG. And these formulas ensure the reading levels for your intended audience. Now, incorporating images to enhance messages. Images should only be used if they improve the impact of the message. They should only be used in an ethical way and obtain the rights or permissions to actually use the images. Try to use images that include individuals within the audience that the message is intended for, as well as the supporting cultures within those populations. Another good way to reach the community through imaging would be photo voice. This is a great way of including community members, but it also promotes dialogue and it reaches policymakers because it's a grassroots approach. It's a visual grassroots approach. You have individuals from the community voicing their opinions, and they are in a visual way. You record them, they state their messages, and then it can be passed on. So when people are taking in your information, they don't hear it from you or from an organization, they hear it from the community. So it just makes it a lot more, it makes it easier to take in the information and receive the message. It's almost like that peer-to-peer learning approach. Select effective methods or channels for communicating to priority populations. This is exactly what it is. You choose the channel you want to disseminate your information. With further research, a health education specialist will find there are plenty of channels to choose from. Upon my reading, I found 8 different interpersonal channels, like hotline counseling or instruction. There were 6 organizational channels, like newsletters or educational programs. There were 6 community channels, like faith-based organizations and campaigns or speeches, and countless mass media channels that includes news and advertisements from television, radio, newspapers, and the internet. Now, pilot test messages and delivery methods with your priority population. This is the perfect time to test messages one has carefully created through focus groups, interviews, questionnaires, and other ways of testing your material. A few tips to remember when you're testing your messages, though. Keep in mind that you need to include your intended audience, but also your gatekeepers, your opinion leaders, and your community advocates that represent the target audience. It kind of displays a tiered support system, and you have people from different levels giving out the information, and whatever information they're taking in, you'll get different viewpoints from it. So this is a great way to get feedback from your message with different perceptions. Take note of your budget, relevancy, and your audience's understanding of that message. A great outline for piloting and revising would be the CDC Synergy Social Marketing version. Now, revise your messages based on pilot feedback, which is that. After testing, you revise your messages based on whatever the feedback you get on the different levels of approach and perceptions. In order to keep costs down, though, remember to include the priority population with your changes quickly and efficiently. Do not, when you're testing your messages, make sure that you have everybody within that group the first time around, as opposed to doing it in increments, and then your message will no longer be available, or, Competency 3. Deliver your messages using a variety of strategies, methods, and techniques. Competency 3 incorporates how to identify and develop these strategies, methods, and techniques. Use techniques that empower individuals and communities to improve their health. Within this area, techniques for delivering messages address how to reach out to your audiences, starting from the individual level to the community level, as well as addressing points for delivering messages through a social network, organization, or societal level. You can reach the mass through persuasive communication, which means tailoring health-related messages to audiences' needs in an effort to persuade them to adopt healthy attitudes and behaviors. Now, try to employ technology to communicate to priority populations. Use electronic communication such as email, interactive television, chat rooms, amongst many others, when you are able to reach the highest amount of your target audience. Again, be mindful about poor, inaccurate information being circulated when it comes down to the internet, because this can create risks. Again, always make sure that your information is credible and accurate. Then you evaluate the delivery of your communication strategies, methods, and techniques. At this point, evaluations are needed, and the data collected must be used to improve the delivery methods that were just previously mentioned. Competency 4, engage in health education advocacy. Advocacy, in simplest terms, refers to one's voice, or voice in action. Advocacy influences policy. Therefore, advocacy skills are imperative for health educators, because they must find a way to share their voice when addressing issues within the community on a local, state, and national level, in reference to organizational leaders, public officials, or legislative bodies. In other words, you will be campaigning to this section of the population. Always remember, advocacy, your target audience would be organizational leaders, legislative bodies, public officials, because now you have already gained the support of the community. You have identified your issue. You have already researched, gathered up your data. You have support, you already have a good running support. So at this point, it's time for change. So this section, Competency 4, kind of engages how to get the policymakers to create and implement your change. You do this by, engage in health education advocacy. You do this by creating an evidence-based public health policy campaign. A health educator researches and knows the health policy information once an advocacy issue is identified. Health educators then need to know who the individuals are, who are the individuals that need the help, who is currently involved, who is already advocating, and who would want to assist with those changes. After you locate the individuals, you need to develop an advocacy plan in compliance with local, state, and federal policies and procedures. In order to comply with policy and procedures on every level, there are steps in policy development. These steps include gathering the data involved, develop campaign goals, gather your resources, pick your targets, and choose your tactics, which is all referenced as your overall strategy. So this would be your advocacy campaigning strategy. And be aware of your limitations within advocacy policies and procedures. For example, I read that a nonprofit organization has federal regulations on how much time that they can contribute to lobbying. In addition, if you are a health educator that works for a governmental agency, there are times that you can't even lobby at all. So it is very, very imperative that you know what your organization's policies are and what the government policies are. From that point, you already know what you are able to do in that spectrum. Comply with organizational policies related to participating in advocacy. Please remember that a health education specialist must always adhere to the current laws and policies that are already established and enforced. One must take heed and stay within their scope of representation. When representing an organization, it is imperative to familiarize yourself with the organization's policy for advocacy within one's scope of practice. One example includes not performing certain advocacy activities while on organizational time. Pretty much, if you are currently working and you're supposed to be doing your job, you cannot set aside and start a picket line in the middle of doing your whatever it is that you're doing. If an individual is acting on private citizen time, take close care not to use an organization's resources, which may include phones, laptops, letterheads, the organization's name, and especially time. You only use the organization's name if you are allowed to do so and if it has been already approved. And worst case scenario, when in doubt, always refer and adhere to the Code of Ethics for the health education profession. Now, communicate the impact of health. Communicate the impact of health and health education on organizational and socio-ecological factors. A health education specialist has a responsibility to communicate how health education plays a strong influential role on the impact of health in all settings in reference to generating and influencing policy. It must be communicated that our roles in this profession include implementing, evaluating, translating, and disseminating effective health education and promotion practices. Use your data to support advocacy messages. Although only 6.5% of reviewed law provide research evidence that supports law, a health educator's role includes preparing data for quick and practical dissemination. So pretty much only 6% of our laws actually have research evidence-based approvals, and all the other laws are based on data that has been taken in, like quantitative data, qualitative data. So they have to go by setting these rules, even if it's not evidence-based at times. The problem with new policy is that the data is not always readily available when monitoring the effects of public policy. However, should an opportunity to create or change policy arise, a health educator should have already collected as much data as possible in the form that shows that there's public health burden. It demonstrates the priority of the issue over other issues, shows relevance at that voting level. So if you're pitching to the mayor, you need to make sure that you're at the city level and the change can be created at the city level. Demonstrates the priority, shows benefits of an intervention, or if there is harm, you want to show how the intervention needs to be ceased. And personalizes the issue and estimates the cost involved. Now it's time to implement your advocacy plans. This subcompetency gives more detail of the campaign strategy that we addressed earlier. Once developed, a health educator will carry out those 5 elements in the advocacy plan and also identify their allies. Allies are the way that a health education specialist can have connections to and influence over their targets. Keep good records of activity to help either reinstate these strategies for future use. Incorporate media and technology in advocacy. This is very similar to what we covered in subcompetency 3 with delivering your message. However, utilize the media and technology specifically for legislative actions, for voting, to search for elected officials and get their contact information. So if you would like to send letters and put things in writing, you can contact them. Participate in advocacy initiatives. The last two subcompetencies are more on a higher level. So once a health educator has implemented the first few subcompetencies, once you are at an advanced level, you can lead the initiatives and then you can evaluate those advocacy efforts. Competency 5 starts with using the evaluation findings that we all just spoke about and put them into some form of policy analysis. In addition to identifying and promoting the importance of health policy and how it affects the public, the health educator must stay updated on the policy changes and health changes. One must also keep in contact and know who are the individuals that are still involved, and always keep track of the various influences from the various individuals that are still active in the community, still active in the legislative bodies. So you must constantly always update and keep in contact with these individuals. Promote the health education profession. This part of Responsibility 7 is pretty much the self into the community in reference to the actual, into becoming a health education specialist. 7.6.1, develop a personal plan for professional growth and service. This step is on the individual level. It just focuses on institutional education and reaching advanced level as a CHES person. So this is all getting your master's, getting your doctorate, gaining more experience, involve yourself as much as you can. So this section addresses what you can do on a personal level to improve yourself and to become a better CHES individual. The other sections from describe the state-of-the-art health education practice, explain the major responsibilities of the health education specialist in the practice of health education, and explain the role of health education associates in advancing the profession. This section, in a nutshell, is know the responsibilities, competencies, and subcompetencies. They will assist you in explaining what it is that you do and how it is all done. And in addition to this, it points out the benefits of utilizing a CHES individual. So what you do is know your job, know how it's done, and when you're speaking to individuals, you can kind of boast about what it is that you do and give yourself props in addition. No. And then just let them know that it is extremely beneficial to use a CHES individual because this is what we do and this is how we do it. It's just a great way to also promote the industry and get more CHES individuals involved. The last section of promote the health education profession, it explains the benefits of participating in professional organizations. The organizations mentioned in the intro and in the previous responsibilities are all part of a supportive network in our industry. Becoming a member or becoming an active member assists a CHES person to advance their expertise, create a great network, give outstanding support, and it helps advance the industry as a whole. So joining these organizations, you will be able to kind of create a force amongst a mass of individuals that are all geared towards the same end product, which is promote health education. You get a great network. You meet and greet people all the time that can actually help you and join on board, and you guys can create coalitions. You guys can create new organizations, and it will all be done through participating with actual professional organizations. This is a great way to build yourself and build a community through peers that are joining in on the same mission that you have. So the last few subcompetencies were already addressed in the introduction, which is the history of CHES. Why is it important? History of becoming a health profession, health education professional. How to explain the role, what the responsibilities are. The last part of Responsibility7 just addresses everything that we already covered in the introduction, so we don't have to continue and repeat that part. And that actually concludes Responsibility7 and the workshop itself. No. So thank you for listening, watching, and studying. Good luck.